All right, guys, and welcome back. The Nclex question of the day is going to be on Coumadin and A.Fib. All right, guys, so before we get started, let me just show you a few things. So if you like what you see, click the subscribe and the like button down below. And to see more, click on more and go down to the Nclex playlist, where you have access to all the Nclex style questions and question reviews that I've done to date. All right, hope that helps. So Nurse Labs has an excellent array of questions for the Nclex. So you can scan the QR code or click the link that I'll put in the descriptions to take you to Nurse Labs. This patient is a 72-year-old male with a history of A.Fib, controlled hypertension, who has been initiated on Coumadin therapy, also known as warfarin therapy. On assessment of the patient's history, it was revealed that he had a history of peptic ulcers. This patient has also had a recent history of peptic ulcers. Given the patient's medical history and current medication regimen, which of the following instructions should the nurse prioritize when providing discharge teaching? Will it be A, report instances of diarrhea, B, avoid foods that are high in vitamin K, C, use a straight razor when shaving? Will it be D, take aspirin for pain relief, E, monitor for signs of bleeding such as bruising or tarry stools, F, check blood pressure regularly at home, or G, inform all healthcare providers about anticoagulant therapy? So before we answer the question, let's go back and take a look at our question. What is important? What do I need to focus on? And so I've already kind of highlighted in yellow the things that I think are important. Number one, he's past age 65. Well, why do I care? Well, when you're over age 65, the chance of having a major side effect that's going to put you in the hospital doubles. In particular, GI bleeds also go up. Okay, next thing we have is atrial fibrillation. So this is why he's taking medicine in the first place. So when you have atrial fibrillation, top part of your heart, the atria are not moving blood right. So blood pools in the atria, clots that can then break off, cause you to have a stroke, heart attack, kidney damage, pulmonary embolism. So we have to take Coumadin because we don't want this man to be having a heart attack, stroke, and so on. Okay, next thing, controlled hypertension. The reason why this is important is hypertension is a risk factor for GI bleeds. But the good news is for this man, it is controlled, so that's not quite as important. If the blood pressure is greater than 160, yeah, we're majorly increasing the risk for GI bleed. All right. Thirdly, he is on Coumadin, also known as warfarin. That's going to be a risk factor for bleeding, but it also is going to reduce the risk factor for him having blood clots. He's still at elevated risk, but not as high as he was. All right, next is he has a history of an ulcer, and he's had ulcers recently. This is a major risk factor for him bleeding into his gut. So now the question is, given all that information, what are we going to focus on? What intervention, what teaching point is going to be the most important for this guy? So let's put all this together in a nice short sentence. A 72-year-old male with controlled hypertension, A.Fib, and a history of peptic ulcer who is currently on Coumadin. Which of the following instructions should the nurse prioritize when providing discharge teaching? So our first option is to report instances of diarrhea. All right, and the reason why they're recommending this is what happens. I'm taking the medicine by mouth, it has to go through my gut, and from there it has to be absorbed. If this medicine goes directly from my gut to the toilet, it didn't do me any good. It's not going to help me, right? And so with diarrhea, medicine's moving through the system faster, the GI system faster, so that means there's less of time for my gut to suck up that medication, in this case Coumadin. But that also means my gut has less time to suck up vitamin K. As a matter of fact, vitamin K, a lot of it is being made by our gut. And so the bacteria in our gut are breaking down food and creating vitamin K. So there's actually a case study where a woman, she had Coumadin for some sort of heart issue, probably A.Fib. Anyways, she had diarrhea for 4 days, and they measured her INR, and it actually went up, but she didn't have any sort of GI bleed, didn't really have any symptoms. So, doesn't seem to be like crazy important here, right? Not bad to definitely report, but definitely not the most important thing. So my next option is to avoid taking foods high in vitamin K. Well, how does Coumadin work? Well, Coumadin works by lowering vitamin K. Well, if I'm eating foods that are raising vitamin K, I'm pretty much like undoing my medication. And as I said, the reason why I'm taking Coumadin in the first place is I'm worried about heart attack, stroke, all sorts of blood clots coming from my heart causing major damage. So that's pretty important. And unfortunately, that can happen pretty fast. Usually you can have a complete reversal of Coumadin by taking vitamin K within 24 hours. Which, having a heart attack and stroke is a major issue. Alright, option C, use a straight razor while shaving. No, this is just bad medical advice. Right? A straight razor, you're actually way more likely to cut yourself than a safety razor. And so, no, not a good idea. Take an aspirin for pain relief. Okay, there are some times where, believe it or not, you're on Coumadin, you're also going to take aspirin. But usually this is a no, don't do that. Why? Major risk of causing a bleed. And so unless we have a really good reason for doing this, we're not going to do it. Taking aspirin for pain relief isn't a really good reason. Look, I can take Tylenol, get the same level of pain relief, but not having the major risk of a bleed. So our next option is pretty important, right? We're going to monitor for signs of bleeding. Now, here's the thing. It's saying which of these should you prioritize? And so should I prioritize the monitoring for signs of bleeding above avoiding foods high in vitamin K? So what happens if you're taking this medication and you're eating foods high in vitamin K? You feel totally fine. There ain't nothing wrong with you. You don't know that what you're doing is an issue until all of a sudden part of your face starts sagging, or you get this crushing chest pain, or you're having trouble breathing. And now you might have a lifelong disability and or be dead because of that choice. So, really kind of avoiding that would have been better than trying to treat it as it cropped up. Now, option E is for monitoring for signs of bleeding. Well, usually, I don't know about you, but if I don't feel good and I go poop and I see a bunch of blood come out, or I see black poop come out, or I pee and it's red, or I fall down and I get this massive bruise, I'm probably going to be more apt to call the doctor and say, hey, is this normal? Am I okay? Now, you might have some patients that don't know any better, but, how likely is this to occur? Well, even in cases with pretty high INR, generally they don't get a GI bleeding. But, if their INR is too low, the chance of them to get a blood clot is pretty high. Once again, we're giving them this drug because the benefit of lowering that risk of excessive blood clots is going to outweigh the risk of the bleeding. So yeah, it doesn't hurt to monitor, but it's not going to be as helpful as avoiding those high vitamin K foods. So option F, check blood pressure regularly at home. Of all the good choices, this is the least good. Why? Because if I'm taking warfarin, also known as Coumadin, I'm getting my INR checked once a month. And so what's going to happen at those checks? They're going to check my blood pressure. And so whether or not I'm checking my blood pressure at home, I'm pretty much guaranteed to get my blood pressure checked once a month. And it's very unlikely that everything is going to get way out of control within that month. Okay, so inform all healthcare providers about anticoagulant therapies. That's very, very important. My mom knew a woman that was a nurse, and she had Coumadin for her heart. She got a headache, took some medication, and almost died because of it. So drug-drug interactions are a major issue here. And your patients are not going to be aware of all the drug-drug interactions. They think, hey, if the doctor prescribed it, it must be safe. Not necessarily so. So why is this not number one? Well, the reason being is because the safeguards in place. Number one, a good doctor should be asking, hey, ma'am, have you started any new medication since your last visit with me? Right? Number two, the doctor should be looking at the EMR, seeing if any other medicines were prescribed. Number three, the patient should be getting all their meds filled at one place, let's just say Walmart. So when they go to Walmart with a medication prescribed by Dr. Smith that interacts with Coumadin, Walmart's going to call Dr. Smith and say, hey, Dr. Smith, you prescribed aspirin. That's a major drug-drug interaction with Coumadin. Do you really want to do this? And Dr. Smith will look at things and say no, or in some cases he'll say yes. But that is why this is not number one. So looking at all my options, why is avoiding foods high in vitamin K the best? Number one, it's not going to be something the patient's going to think about without you telling them. Number two, it can be the difference between life and death. Number three, it's something that the patient could do right away. And number four, it's not something that other providers are likely to tell the patient. So hopefully that helps. Alright guys, that concludes our tutoring for today. If you want some one-on-one tutoring, please feel free to scan the QR code below or click the link in the descriptions. Until then, I'll see you next time.